Assalamu alaikum everyone, this is Dr. Ujala and today I'm here with another topic which is known as dental occlusion. Dental occlusion is the way your teeth in the mandible, that is your lower jaw, and your maxilla upper jaw are in contact with each other. In layman terms, the alignment of teeth and jaws is what dentists refer to as occlusion. This contact determines the functional relationship of the teeth. People who have normal occlusion do not have any trouble speaking or eating, but people who don't, they might end up with having problems during mastication, that is biting, eating, and speaking. Now, types of occlusion. Static occlusion, which refers to how your teeth are arranged when the jaw is closed and is not moving. Second is your dynamic occlusion, which observes the contact teeth when the lower jaw is moving. Dynamic occlusion is commonly known as articulation. Now, a few definitions related to dental occlusion. Centric occlusion, a position of the mandible when there is maximum intercuspation of the maxillary and mandibular teeth. Second is centric relation, a position of the mandible dictated by the slope of the TMJ and the mandible condyles. This is the only reproducible position of the mandible and is used for complex occlusal rehabilitation. Next up are curves of Wilson, Spee, and Monsoon. Curve of Wilson. This is a curve that contacts the buccal and lingual cusp tips of mandibular buccal teeth. The curve of Wilson is mediolateral on each side of the arch. It results from inward inclination of the lower posterior teeth. This curve helps in two ways. A. Teeth are aligned parallel to the direction of medial pterygoid for optimum resistance to masticatory forces. And second, the elevated buccal cusps prevent food from going past the occlusal table. Then we have curve of Spee. It refers to the anterior-posterior curvature of the occlusal surfaces, beginning at the tip of the mandibular cuspid and following the buccal cusps of bicuspid and molar, continuing as an arc through the condyle. If the curve is extended, it would form a circle of about 4-inch diameter. This curvature is within the sagittal plane only. Third is the curve of Monsoon. Manson in 1920 at a later date connected the curve of Spee and curve of Wilson to all cusps and incisal edges and suggested that the mandibular arch adopted itself to the curved segment of a sphere of a 4-inch radius. Last terminology we have is guidance. Anterior guidance involves the incisors within the envelope of function, while lateral guidance can either be by the canines alone, which is also known as canine guidance, or a combination of posterior teeth, which is known as group function. That's it for today's lecture. This is Dr. Ujala signing off. Thank you so much.